All right, so the first thing I'm gonna do is I'm gonna check my doctor's order. For your checkoffs, you are either going to have a blood draw or a medication administration. You can actually do both. When you access the port, you can draw blood and then give medicine. I'm gonna show you how to do both. But when you come in for your checkoff, you're only gonna do one or the other. And it'll depend on which bed you come to. Like this one, if I'm standing here and I've got the blood draw, you come to me, you're gonna get a blood draw. If Sarah Crick is over there and she's doing the other one and she's doing meds, then you're gonna give meds. So you have to know how to do both. So I'm gonna check my order. My order here says that I'm going to give Zofran 4 milligrams IV push down every 8 hours. And I need a CBC today. Draw blood specimen from Mediport. So it specifies, I can use the port for a draw. I have to have that. Now, once it's written, it's written. You know, if they say, use Mediport for labs, it's a one-time order. You've got it for the rest of that time. But if they write it like this one says, CBC today, draw from Mediport, that's a one-time use. I'll have to get another order before I can draw from it again. So make sure if your doctor writes it, he just writes a general blanket order, unless he really doesn't want to draw. And sometimes they don't. So, I'm going to do Zofran and CBC. Okay, I'm a brand new nurse. I've never given anything, and I don't know what Zofran is. What's my next step? Look it up. And that's what you're going to do when you come in for skill checkoff. You're not going to look it up. You're going to say, I'm going to look up this medicine. Okay. And I'm going to tell you, because what you are looking for, does it need to be diluted? Things like Phenergan. How long should you give it over? And if you have fluids infusing, will it mix with that fluid? Those are the things you're looking for. And I will tell you, okay, I'm looking this up. Okay, that's Zofran. You don't have to dilute it. You can push it over 1 minute. And you're good. So now I am going to get my equipment together out here, because the rest of it's going to be right because I'm already going to have it. I'm going to have tubes because I'm drawing blood. I have to have the tubes because I have to know how much blood I need. That doesn't mean that you have to, for checkoff, know that the purple is a CBC and the blue is clotting times. I don't care if you know that or not. I've given you 2 tubes. So how much blood do you need? How do you find out? How do you know how much goes in there? It says on the tube. So I'm going to look on the tube. The purple one says 4 milliliters. The blue one says 4.5. So what do I need? 8.5. So I know I'm going to have to draw at least 8.5 out for lab, not including the waste. I'm always going to draw a little bit of extra, so I'll get a 10 cc syringe for my blood draw. Put the blood in. If I only need 2 cc's, I may only draw 5. Just depends on what I need. So I'm going to have my tubes. I'm going to have 10 cc syringe for my blood. I'm going to get my medication. When you're giving medication through a central line of any type, you have to use a 5 milliliter syringe or larger. And that's because of the amount of pressure that's going through it when you push. The pressure is much greater in a 3 cc syringe, and you can damage the walls of that port or that central line. It's decreased in a 5 and 10. So I have to have a 5 cc or bigger syringe. I want to look at my medication. Zofran injection, 4 milligrams per 2 milliliters. So how much do I need? I need 2 milliliters. So you're going to have, just like you did with your med checkoffs when this up and had 2,000 syringes sitting out here, you're only going to have like 2 or 3, but still, you're going to have a choice. You can draw it up in your 3 milliliter syringe. If you do, you have to realize you're going to have to transfer it to a 5 before you give it. Or you can draw it directly in the 5. I don't care. Does not matter. So, I'm going to draw it in the 5. There's actually any fluid in it. Okay. I'll take my Magic Infinity of alcohol swabs, scrub it, we know it leaks. Because the rubber's older than you. I'm gonna make sure in reality I have 2 milliliters, and I will check you and look and say, yeah, that's too great. Once I've got it drawn, you will recap. I will not allow you to recap with 2 hands, ever. I will fail you on a skill for that. So you are going to scoop, and once you have it, you can push here to push it together. But you cannot hold 2 needles like that. I do not want any needle sticks. And then I'm gonna say, I'm gonna label it. I'm not actually putting a label on it, I'm gonna label it. Once I have that, I will take my order, my labs, my medicine, into the room. So, and you all can come around if you want. I'm gonna knock on the door. Hi, Mr. Burley. I'm Alicia. I'm gonna be your nurse today. I'm gonna be accessing your port so that we can draw some labs and give you some medicine. Do you have any questions? Have you had this done before? Yes, everything's fine? Okay, great. Do you have any allergies that you know of? No. Okay, that's wonderful. Sit things down. I just want to feel the port. I also want to set the head of the bed up just a little bit, about 20 to 30 degrees. I am going to tell him that I am going to put a mask on him when I get started. I'll also be wearing a mask. I'm going to ask him during the procedure if he will turn his head away as well. So, he's got his head turned. So now I'm going to get all of my stuff together. And what I need, I've got the stuff I brought in with me. I'm just putting it out of the way for the moment. I'm going to open my sterile kit. My sterile kit, the only things you really have to make sure are in this kit is a Tegaderm, some type of cleaning solution, whether it's chloroprep, alcohol, doesn't matter, but some type of cleaning solution, a mask, and sterile gloves. Those are the things that have to be in here. And in your kit, it will either say dressing change tray or central line dressing change tray. Be one or the other. So I'm going to open it. And your second mask is actually going to be sitting on top of it. I'm going to bring him the mask. I'm going to put his mask on, and this is exactly how I do it. I'm going to put his mask on. See, it's not on. I'm going to take my mask and put my mask on. And again, you don't have to wear it. You just have to show me that you're going to put it on. And I'm going to take my gloves out and have them ready and look in and make sure that I've got everything else I need. So now I'm going to have to get the other equipment I need and open them. I'm going to have a Huber needle. It has to be sterile. I'm going to open it and dump. In most of your kits, you will have to have a needleless cap because most of your Huber needles don't come as a needleless system. So you'll have to add this. Some facilities may have a needleless system. If they do, you don't have to have this one. But for checkoffs, you will. So I'm going to open it and dump it in. I'm also going to have a 10 cc syringe that I open, and in an ideal, perfect world, I'll actually drop it totally in there, and it won't hit the edge. It didn't this morning. And I'm going to have a needle. So I will open it and dump it. Those are the things that are going to have to be in here. I have to have my infinity of alcohol swabs. I am going to have one 10 cc saline syringe for every lumen I'm going to be dealing with. I have one lumen. I'm going to have one syringe. If you are giving medicine, you'll have to have two. I'm giving medicine, so I have two. You will have to have one heparin syringe for every lumen you're dealing with. Now, how much heparin is that? You have to check the concentration. The concentration for a flush is 100 units per 1 milliliter. And I'm going to give, depending on the facility, either 300 or 500 units. So when I ask how much heparin, you're gonna say 300 to 500 units per facility protocol, because you're gonna look it up. So I'm checking to make sure that this is the right concentration, because on pediatrics it's a different concentration. We also commonly use heparin 1,000 units per milliliter. Don't give that as a flush. That is too much heparin. So you have to look. That's one of the most common mistakes with kids. So I'm gonna need one. I'm also going to need a syringe for waste, because I'm gonna draw labs. So I'm just opening it. I don't have to put it anywhere, because I won't be sterile totally at that point. So I just kinda got it sitting over there. Okay, so I've got my flushes, I've got my medicine, I've got my syringes for labs, got my gloves, got his mask, got my mask, got everything in here. Can't touch anything in here because I'm not sterile yet. Now I need to become sterile. And just as an FYI, when you're opening, if you will twist, it'll stay open. A pet peeve that I have with students, when you are going to put on sterile gloves, pick up your glove and take a step back, so that when you're putting your glove on, you don't do this. The students do that all the time. What's the problem with that? I just crossed my sterile field. So take a step back so that when you do it, you've got plenty of room. I don't have my back turned to it. I can see everything. I'm done with this, so I can move it. Now I can reach into my sterile field. So what I'm gonna do here is I'm going to take my syringe, put it together. Take my needle. And once we've practiced a time or two, that gets stuck. That's okay. I'm gonna put the needleless system on it. I want to glance at my needle, make sure it's intact. I don't have to take the cover off. And then I can set it down there. Now, I'm going to have to prime this line. In a real life setting, you're going to draw up 10 cc's of sterile saline to do that with. You cannot use a pre-filled syringe, because if you look at the pre-filled syringe on the outside of the package, it says, do not place in a sterile field. Well, that means you can't put it in there, so I can't use it. So you're gonna have to draw it up. So I've got saline here, but this is not sterile, right? The inside of it is, but the outside of it isn't. So how am I gonna draw it up? I'm gonna have to ask for help, exactly. You're gonna have a built-in assistant during checkoffs. So I am going to get my syringe. Like I said, in real life, I'm gonna draw up 10 cc's. For checkoff, you're gonna draw up 1, because Miss Sutton gets really mad when I blow up the bag on the bed. So, 1. So I'm gonna draw back for 1. I'm going to ask my assistant, Miss Missy, would you please come and take the cap off of this, please? Okay, would you take an alcohol swab and rub the top of it? And then if you will hold it, I am going, no, put it down to hold it. I am going to insert my needle, push in my air. Now, would you flip it over for me? Okay, I'm going to pull it out. You just hold it. Now, you can set it down. I've got this. I have to have that tape in there because I can't recap it otherwise. Because you can't double hand it. Okay? So now, and when you are doing this, I will not do a thing for you. You have to tell me everything to do, just like I did her. Rub the top. I know you're smart enough to know to rub the top. I'm still going to tell you to. Hold it. Turn it. You have to tell me everything, but I will do it as long as you tell me to. So now I'm going to take the cap off here. I'm going to take my needle and put it together, and I'm going to prime my line. Once I've got it, I can close that. Now, I'm going to take my ChlorPrep, and this is ChlorPrep. That's what's in here. Check and make sure what you've got. If it's ChlorPrep, how does ChlorPrep work? How do you have to clean?
Circular.
How? Circular. You can do. It's friction based. That's what to know about ChlorPrep. It's friction based. So I have to scrub. I'm still going to scrub in a circular motion, you're right. But I'm going to do it with friction. So I'm going to break this, and again, you don't have to do that. You're just going to tell me. I'm going to break this to get it wet. I'm going to press. I've already palpated, so I know where I'm going. If I don't, I will palpate and figure it out. Does that mean that this hand is not going to be sterile? Yep. So I'm going to make sure not to use this hand if I have to palpate. If I don't have to palpate, it stays sterile. So I'm going to start in the center, and I'm going to scrub in a growing circle until it's about 2 inches across. Then it's done. And I'm going to wait for it to dry. If you actually get our mannequin wet, it takes like 10 minutes for it to dry. In a real person, it's going to take less than 10 seconds. So you're not waiting a long time. Okay? I'm going to get my Huber needle and take the cap off. I'm going to take the butterfly wings and push them together. I am going to, one thing to be very careful of is your clip. Put it where you want it. I like to have mine up here because it's easy to manipulate then. So I'm going to move it. There's nothing wrong with that. There is when you're having to do it one-handed and you touch everything. So I'm doing it now. Now I'm going to go straight down in. I'm going to tell him, Mr. Barley, I am going to access your port. So on the count of 3, 1, 2, 3, and I'm going straight in. And it's going to stop itself. It's only going to go so far because it's going to hit plastic. So once it's in, I'm going to unclamp, and I want to check placement. How do I check placement? I draw back. I'm looking for blood. And typically he will give us blood. He's not right now because I think I've used too much. But so I'm going to look for blood. Once I have blood, now I can let go. I'm not going to wiggle it. I'm just letting go so that I can again control my clamp. So I'm going to flush. When you flush, you're going to push, pause, push, pause, push, pause, push, and clamp. Because I want pressure going that way as I clamp it. That's important so that you don't get backflow. Once I've got that, I want to put this where I am going to put my dressing. I don't like to have it stretch this direction because now it's going across him. I don't want it pointing down. I usually point it going that direction. I'm just going to drop it because it's going to be out of his way and out of my way where I can use it when I need it, don't have to otherwise. I am stabilizing it on top. I haven't touched anything on him. I'm just touching here. Now I can take the Tegaderm. You know how to use Tegaderm. Once I have the Tegaderm, I can lay it down, and my sterile part is now done. I can take off the mask. He can take off the mask. I still need gloves, but I don't have to have that mask on anymore. So now that I have done that, I'm going to draw blood. Remember, I have a waste syringe. Blood comes before medicine if you're doing them together. Take my old syringe off, scrub my hub, attach, unclamp, and I'm going to draw back my 10 cc's of waste, clamp it, either set it aside or discard it, whatever needs to be done with it. Take my blood draw syringe, get an alcohol swab, scrub the hub, and I'm giving it a second or two between it to dry. Doesn't take but a second or two. Clamp, or put it on, unclamp, draw back the amount of blood I need, clamp, because this is the fancy mystical world of nursing school. You always have lab at the bedside. Yeah, that never really happens, but you always have lab here. So what I'm going to do once I have it, I'm going to give it to lab, just like that. Okay? In the real world, you're going to leave it on the bedside until you can switch it over, but you're not supposed to do that. Now I'm going to give my medicine. Before I give my medicine, I have to flush. So I'm getting one of my flushes. Get the air out of it. Please get the air out of it first. Don't squirt me in the face with it if you can avoid it. I won't fail you if you do. Scrub my hub. Put my flush on. Unclamp. Push, pause, push, pause, push, pause, push, pause, push, and clamp. Throw my syringe away. Get an alcohol pad. Get my medication. I'm going to give it over whatever time. So if it's 2 or 3 minutes, I'm going to push and pause, push and pause, push and pause, so that it's the right amount of time. Clamp, discard that syringe. Now I'm going to get my flush so that I can get ready to leave the room. Get the air out, scrub, put this on, unclamp. Push, pause, push, pause, push, pause, push, and clamp. Discard, get my heparin. Push the air out. Scrub the hub. Put this on, unclamp. Push, pause, push, pause, push, pause, push, and clamp. Now, I'm done. If I don't have any other meds, I can hook it up to fluids if I need to, but I'm finished. So I will take my trash and put the patient back in their comfortable position, make sure they have their call light, make sure they're not having any problems, etc., and leave the room. Now you are going to come back 7 days later, and this patient is going to go home. So I need to de-access the port. To de-access it, the first thing I have to do is flush it for every lumen that's there. So I'm going to come in, it's a single lumen. I'm going to make sure I have one saline syringe, one heparin syringe. I'm going to have a mask for him, a mask for me, and gloves, and some alcohol. That's it. So I'm going to come in. Hi, Mr. Burley. You're going home today, so I'm going to take this needle out of your port so that you're able to go home. I'm going to have to put a mask on you while I take it out. I'm going to wear a mask as well. Do you have any questions? Nope. Okay. Do you have any allergies? Nope. That's great. We're going to get going. So I'm going to take his mask, put it on him, ask him to look away. I'm going to put my mask on. I'm going to put clean gloves on. I am going to get alcohol, scrub the hub. Push any air out. Put this on. Unclamp. Push, pause, push, pause, push, pause, push, and clamp. Scrub the hub. Get the heparin. How much heparin? 300 to 500 units per facility protocol. Attach. Unclamp. Push, pause, push, pause, push, pause, push, and clamp. Discard. Now I'm ready to take the tegaderm off. I'm going to take the tegaderm off and throw it away to expose this. Just like I did in accessing it, I'm going to take the wings and push them together. I will usually stabilize like this, not right at the site, but around. Stabilize it. I'm going to tell him, Mr. Burley, I'm going to take this out. If you'll take a breath and exhale, ready, take a breath, exhale, and we're done. That just reduces the risk of pulmonary emboli. Not a huge risk anyway, not going to kill him most of the time if you don't do that, but we're going to tell you it helps. I want to look at the needle and make sure the needle is intact. So it's not bent, it's not broken. As long as it is, I can then discard it in a sharps container. put my patient back in his comfortable position, make sure he has his call light, take his mask off, take my mask off, wash my hands, ask him if he has any problems, and leave. That's the whole skill. Okay, any questions?